Good afternoon, ladies and gentlemen. I'm really delighted to be with you here today. And finally, after what has been an extremely long journey, figuratively, literally, every kind of way you can possibly imagine, a journey to a world where ERNs actually exist now. It's been eventful. For all of us, I suppose, in the room, we all have had our experiences, regardless of the agencies and the organizations that we represent. It's been filled with twists and turns, but when we look around the room today, and we see, as Vicky Headley said earlier, 8,000 rare diseases now represented in 24 networks that will provide a home for all rare diseases, I think we can all agree that all of the trauma and sleepless nights and exhaustion and all the rest of it, twists and turns, were all worth it, right? They were. And they will be. Of course, like all challenges and journeys, this one taught us a lot too. It taught us a lot about ourselves, about those we work with, and what their priorities are and must be. And learning that is very important. But it made us really come back to why we were involved so actively in this purpose for so many years as advocates. It's simply to improve the delivery of care in Europe to patients living with rare diseases. Full stop. So my name is Avril Daly. I'm the CEO of a patient-led umbrella organisation called Retina International. And our members in the four corners of the world are people who are affected by rare retinal diseases, who have funded research and development in order to find treatments and cures, as well as develop policy. And today, as a patient representative on the ERN EYE, I've been asked to discuss our journey so far, our start. So we believe that the ERNs is a sensible route towards to diagnosis and to care. And, you know, I suppose I have to say one of our big issues at the start went back quite a while before the ERN announcements, in the list. We had to make sure that the eye was seen as an incredibly complex organ in its own right, not just as part of the brain or lumped in with the eye, ear, nose and throat. This is an organ that requires its own focus and its own network, particularly in the age of significant innovation in ophthalmology. In order to move forward, we needed to have a task force. So we now have 30 HCPs in 13 member states. And our big audacious goal for ERN EYE is to have this new focus on eyes. So how do we do this? So I have a list here. I won't go into all of them because I know we're pressed for time. But it really is about delivering the absolute best care, which starts with a proper diagnosis, a care pathway. And we, of course, are very interested in the area of innovation. And so the development of access to clinical trials and ultimately access to the emerging treatments is something that we're particularly interested in. So what were the areas that we were going to look at? So we have rare retinal disease, neuro-ophthalmology, pediatric ophthalmology and rare eye immune disease, and anterior segment. So, as Rebecca said, this is a bit of a puzzle. And how do you put all of the puzzle together? So we looked at this from a bottom-up approach. And we took every opportunity that we could as patients. So, the first thing we did was we knew that there would be an announcement made by Matt, I always remember Matt Johnson, at the Awardis meeting in Madrid 2015. And that opportunity was fantastic because it allowed us as patients to meet with other groups who were involved in the rare eye disease space, the retina, neuro-ophthalmology, parents of children with pediatric conditions, and aniridia. I remember us all huddled around small tables in a hotel lobby in Madrid talking about what our next steps were going to be. And we were also lucky that a big event was coming up soon. In September of that year, the EU Retina Conference in September 2015, which had over 5,000 eye care specialists in the EU and beyond taking part. So what we did as patients was we organised 2 round tables. The first round table was for ophthalmologists, and we brought the ophthalmologists together to explain, the ERN process is coming, it's going to be complicated, no, we don't have all of the answers, no, there's no money, but you've got to get your act together and we've got to go for this. The second meeting was with the patients the next day, and we discussed how we would advocate for the eye locally at national level with the Board of Member States, and also, of course, support our networks going forward. So Then, after that, we had the very first patient symposium at this event where we discussed the ERN. It was the last of the day, but we got some good engagement. People stayed around and listened to the patients' information, which was really, really great, and we really appreciated it. So what was the next step? So we had an initial meeting of ophthalmologists, clinical professionals and researchers, along with patients at the Retina International office in Zurich. And that was where we started to look at where do we go from here. We needed a coordinator, and thankfully, Professor Helen Dolphus from Strasbourg was appointed as our coordinator. And then we looked at who do we need to bring into this, who is not here yet, who would really be interested. So we worked on that. But as patient representatives, we really needed to turn our attention to the EPAG elections, which were taking place in March. Now, this is a complicated process, but we were lucky. We have 6 very, very good EPAG representatives representing all of the areas who have really good experience. But I suppose it must be said that we had some challenges here because some of the really great patients that we know, they felt that maybe they didn't have the capacity at that time to get involved in something that was really unknowable. So I'll refer to that later, but it is complex getting people to participate at this point. It was very early. So then we started our kick-off meeting back to the clinicians. So the patients met with the clinicians and the researchers at our hub in Strasbourg. And there they all are. That's our motley crew there in the picture. Our very first meeting on the 18th of April. And that's where we really discussed the application process and finalised the particular conditions that we would look at. So the process started in earnest. There was a conference call every Tuesday evening and always with patient representation, every call. However, it's very important to mention that from a scientific and clinical perspective, it was important to let the professionals discuss these particular areas, but always be available as patient representatives for advice and support, and we were the whole way along. So this approach really worked well, and we submitted our application, as the rest of you did, on June 21st, 2016. Took a sigh of relief for about 3 weeks and then started the rest of the process. But thankfully, we were accredited in December of 2016, and here is our coordinator, Helen Dolphus, and project manager, Dorothy LaRue, who are fantastic professionals in how they have supported us as patients every day, even today, helping myself and Christina, who are both visually impaired, get our lunch in kind of a dark room. So thank you, always there to support us too. It's very important. So now, we still have a lot of work to do, because we have to get more patients involved in developing our EPAG. So what we have done is we started in January a mapping exercise across Europe. We contacted every single agency that represented patients with vision impairments, talked to them about this process. Some weren't so familiar with the clinical environment. Maybe with ophthalmology, you might imagine people were more interested in the area of rehabilitation. But there is a place for that too. And we were telling them that, in order to get involved, don't worry. We're here to support you. There's plenty of processes to support. So in contacting 30 agencies, we've got 2 patient representatives who are willing to join us from March. So we feel we're well covered for this particular part of the process, but we know that we will have further engagement as the year goes on, when we can build awareness and show exactly what is required of patients. So looking to the future of patient representation, it is critically important that patients be involved centrally on various committees, and it is important that they're also very importantly represented on their national HCPs. So this is a two-pronged process. We have a central hub and we have all of these spokes that we need to populate. We'll require a stepwise process of awareness, engagement and education. And the EPAG themselves, they are charged with finding the patient members locally and from a European perspective. We must provide leadership training and education on these complex subjects. So how are we going to build on the patient knowledge and expertise for effective collaboration on ERNs? So EURORDIS will develop training and leadership modules to support EPAG members to be able to really grow and learn from each other. So this will be very important in the delivery of the ERN to ensure effective participation. In very complex areas, EURORDIS will develop transversal focus groups on specific areas across ERNs. So, for example, if you're particularly interested in research in your ERN, you would join that group. Or if, for example, clinical outcomes, guidelines, research, the various registers, the various areas. We will have focus groups to provide the opportunity to brainstorm and share our learnings across the ERN groups and support each other and learn from each other. EURORDIS experts will share appropriate groups, so the experts within EURORDIS will support us as patients in order to be able to address these issues collectively. And these focus groups will work across various different ERNs, as I've said, where appropriate to do so. We want to really make patient expertise visible across Europe. So some of these issues will be hugely complex, as we said, but we will work together to reach the goal that we have set ourselves. It's going to be a challenge, no question, to ensure that the ERNs are anchored into the national healthcare systems and to connect knowledge and experience of leading clinicians, researchers and patients to generate knowledge, to eliminate the diagnostic odyssey, to have open access to leading treatments locally, which are prescribed against evidence-based guidelines, to ensure transparency of outcomes of care and to give quality improvements, to create a critical mass of patients and data, pushing the pace of research and evidence-based practice. We have advocated as patients for the ERNs for well over a decade now, and we will do all we can to populate them with the experts, the patient experts that are required. We believe that they are central to the collaboration. They have much to offer, and we all have much to learn from each other. I heard it mentioned already earlier, in the process of, if you look, for example, at our slogan for ERNs, it's care, share, cure. In order to get to the point of cure, we need to share our information. And we as patients, we will do that through patient-reported outcome measures and through any opportunity to be able to say, this is what is important to us, to ensure that you as clinicians have the best information when you're devising your tools to look at innovative practices for healthcare into the future. So we will work together and we will deliver a better future for all of us that we can share together. And I thank you for your time and for your attention, as I think I'm just holding you up from your awards, so thank you.